Okay, welcome everybody. Thanks for joining the March 2022 quarterly meeting of the Chicagoland Healthcare Workforce Collaborative. We'll get started, even though I know more people will be joining. I'm April, I'm the project manager of CHWC, and I'm going to hand it off to Ashley Casiello from our steering committee from University of Chicago Medicine to get us started today.
Good morning, everybody, and thanks for coming to our quarterly meeting this morning. As a quick overview, I'd like to talk about who we are as a collaborative, what our mission is, and what our strategic pillars are going forward. So the collaborative unites employers and industry partners to support an inclusive healthcare workforce, provide accessibility for unemployed and underemployed populations, and develops innovative responses to the evolving needs of the healthcare industry. Our strategic pillars are to focus on local and targeted hiring, focusing recruitment efforts in areas with higher concentrations of unemployment. Education and training is our second pillar, with a focus on bridging the gap by uniting a variety of different partners across healthcare industries to bring education and training to our workforce. And then retention and career pathways so that we can offer education and training opportunities to new career pathways for employees as well as our community members. So the CHWC is an employer-led sector partnership, which means all the folks with the seat at the table, so to speak, are fellow healthcare employer partners. And you can look at some of our employers here who are part of this collaborative, including UCM and many of the folks that you see here on this slide. We also have a number of strategic partners, which would be our education providers, community-based organizations who support our strategic pillars, and other stakeholders who are really crucial to have their input and say, but they don't necessarily direct the actions that we take as a collaborative. Today, we're going to be going over our strategic plan. It's gone through, we've shown a few drafts of what our strategic plan looks like so far, but it's gone through a few different iterations, and the steering committee has approved the final version, which is what we'll be presenting today. Then we'll have a presentation on our Youth Pathways Committee, an update on our events and the Youth Pathways Directory. There'll also be an update on the career pathway mapping project that we have going on, a status update regarding our Good Jobs Challenge grant, as well as a description of what that is and what it'll mean if we get the funding that we've gone after. So excited to hear more about that, as well as some upcoming events. We also have a few folks discussing some partnership opportunities today, including Rosalind Franklin's new nursing program and Upwardly Global, which will have a presentation on hiring internationally trained healthcare professionals. And then at the end, we'll have any announcements from our partners. So our one-year vision for a strategic plan as the healthcare collaborative is that the CHWC becomes the go-to organization for employers and community partners who seek to create a more inclusive workforce for healthcare and share best practices and build out our workforce pipelines. We also hope that all employers and strategic partners are actively engaged in this plan and that they attend, a number of CHWC events and things that we hold as well. So our ongoing priorities right now are to build employer engagement so that we can see that vision of active folks at the table here. We facilitate peer learning and foster connections. We leverage our collective voice and strengthen organizational capacity and sustainability. We have a few core projects going on as well that align with our strategic priorities. Some include to promote healthcare careers. So we have a number of different committees working on this, including Youth Pathway Committee, which is establishing a number of events and a Youth Pathways Directory. We also have a few projects focusing on adults in partnership with community organizations. We also hope to strengthen career pathways. This we plan to accomplish through the Career Pathway Mapping Project. And if we do gain additional funding and capacity, we hope to be able to launch new pathway programs as well. So now I'm going to hand it over to Anna from Advocate Aurora to give us an update on the Youth Pathways Committee.
Thanks, Ashley. As Ashley said, my name is Anna Helbig. I'm a program manager with Workforce Development at Advocate Aurora and a proud member of the Youth Pathways Committee. So this committee was formed after the Youth Pathways and Career Awareness Industry convening last year, where we came up with two ideas for the collaboration. The first one being large events to bring students together to learn and to network, and the second being a directory of all of our programs to better facilitate cross referrals. So I'm going to go over the events portion, and then I'm going to turn it over to April to discuss the directory. So on this page here, you can see that the first event took place in December, and the target audience was for college students. This was a free virtual event on the Kuva event platform and provided the attendees an opportunity to learn and to put into practice their elevator pitch, along with exposure to available training programs and opportunities at the CHWC hospitals, and to listen to healthcare professionals in a panel format about their career pathway. As we move on to the next slide, you can see that we had 328 students who registered for the event and 150 attended. Overall, the committee was very appreciative of the feedback that they provided, as you see on the screen, that we received from the students after the event. And if we move on to the next slide, April, you can see that we have a second virtual event coming up this Wednesday evening, which is another free event, but it's for high school students to expose them to upcoming summer opportunities, and then to also learn about that directory, which was our second priority. So please share this event with your students as it is coming up this Wednesday. And then April, I'm going to turn it over to you to talk about, and April put the flyer in the chat. Thank you, April. And so I'm going to turn it over to her to talk about the directory.
Thank you, Anna. So yes, we have built a searchable directory that lives on the CHWC website of all of our programs across CHWC hospitals that face youth. So it's for high school students, college students, also middle school students. It could also include programs for youth who are not enrolled in any programs currently. And it is now live. So I'm going to share my screen and walk you through it a little bit. We are still working on getting all of our programs up and in the directory. So it's a work in progress. But as you can see, this is the CHWC website. And up top here, we have this button for the Youth Pathways directory. So if you click into that, you can see this searchable directory, which is actually powered by careerpathways.net. Many of you have probably heard about that site before through these meetings or other meetings. That is a website that contains many different programs that offer training programs or pathways into quality jobs with low barriers to entry. And our goal is that someday this Youth Pathways directory that's focused on healthcare programs will join other sectors in a youth section in youth and careerpathways.net. However, it can still live in the CHWC website as a healthcare only specific directory. So as you can see, you can search by different career paths. So if you're interested in health IT or public health or allied health or nursing, those are search functions you can use. There are locations, whether it's in Chicago or in the suburbs. You can search based on your age group or what school you are enrolled in, or if you're not currently enrolled. You can search based on whether the program is paid or unpaid. You can search on the type of program, which includes apprenticeship, internship, job shadowing, training program, or other. And you can search based on season. So right now we're focused, that this Wednesday event is focused on summer programs for high schoolers because many of those program application deadlines are nearing, but we intend to include all types of programs in this directory, whether they're full calendar year or a particular season. So right now you see we have 15 programs that are live, but we're working on adding more even today and tomorrow prior to tomorrow's info session. And then after tomorrow's info session, I really want to get out and find all the programs that exist in Chicago, whether or not they're hosted at a CHWC hospital. But if they are healthcare, I would love for them to live in this directory. So you'll see, let's click into one. This is the Champions Summer Internship Program at U of I Health. And there is a spot, if this program had its own website, there would be a link for it up here. There also may be links for social media if the hospital systems have that. There's space for a general description, type of internship, where the program is located, how many slots are in the program, if there is any cost, what the cost is, although I think that all the programs on this site currently do not have any cost to participants. There's also a section for participant requirements. So if someone is required to have a certain, be a certain age or pass a drug test or background check, or meet citizenship requirements, that information would live here. There can be several sessions listed here, start dates and application dates. There are application instructions and a link to fill out that application. And each entry has a place where they can access an actual person to learn more. So let me stop there and see if there are any questions about the directory or the youth pathways work, or the strategic plan, anything we covered so far. And let me drop into the chat the Chicago Healthcare Workforce Collaborative website, so you all can peruse around the directory together. If anyone has youth programs that are not currently, if you're not currently involved in the Youth Pathways Committee and you have programs for youth, I encourage you to reach out to me to get your programs on this directory. Many of them are being entered prior to Wednesday for the high school info session, but there are also programs that are still being sorted out. I know that not everyone has their details figured out, especially, with COVID and knowing whether things are going to be in person. And so this is a living, breathing thing. Whenever you have a program that you want to live in the directory, reach out to me. It's very easy to get you an admin login, and it's easy to put all that information in there and keep it up to date. So with that, I'm going to move on to our next update. Our other big project that we're working on right now is our career pathway mapping project, which many of you probably know about. This is something that came out of ideas in ideation sessions and follow-up discussions at about this time last year. We had many discussions about our desire to keep our employees within healthcare and provide them with pathways up into family sustaining wages, family wealth building wage jobs, but that we didn't really know how to do that because we don't always know what the next logical step is on the career ladder. We don't always know what the training and support programs are to help someone get into those roles. So we thought that career pathway mapping might be something that is useful, and putting together resources that are job seeker facing and employee facing so that they can understand the different opportunities to move up and how they can get there. So this project was built around three main goals. One is to investigate what is actually happening right now. So to look at employees in entry-level clinical positions and figure out how are they moving up into those family wealth building roles. When they are, what's enabling them to do that? When they aren't, what are the barriers, and how could we address those? And with that, we want to compile findings and recommendations, which will influence our future work within the collaborative and probably influence our any pathway programs that we decide to build towards the end of this year or through next year. And we also want to compile those job seeker and employee facing career pathway map resources. So something that we could do with this information, or that we intend to do with this information, is build out pathways in careerpathways.net, which is that same website that has powered the Youth Pathways Directory. They have a pathway builder tool, which does exactly that. It is supposed to be for job seekers and employees so that they can say, I'm interested in healthcare. Where can I start? Here are a couple different places. I could start and become a CNA, or I could become an MA, or I could become an entry-level tech. And then where do I go from there? And they can build a progressive career pathway and understand what they'll make at each step of the way, how long it will take them to get there, and where they should seek out training or other supports in order to get them into those roles. So we have five of our CHWC hospital employers have joined this project. Thank you so much to UCM, UI Health, Northwestern Medicine, Advocate Aurora, and Rush. And right now I'd like to hand it over to our consultant with work, Ellen Frank Miller, who will be leading this project to give you a little bit more detail.
Thank you so much, April. It is a pleasure to meet everybody, and I'm so excited to be working with all of you on this project. So what I am going to do today is a very high-level overview, and then April and I are both happy to talk further about it. So quick introduction, I am Ellen Frank Miller. I am the founder and chief scientific officer here at the Workforce and Organizational Research Center. I am also a Crown School trained graduate, and was very excited to be part of UChicago for the years that I studied for my master's in social work and my doctorate. Here's my introduction by the numbers. Prior to pursuing academia, I was in human resource consulting for 15 years, then moved to UChicago for graduate school, and I was with Washington University in St. Louis for 5 years in what's now the Social Policy Institute. And I was telecommuting before it was COVID cool here from Chicago while my son was finishing up at Evanston Township High School. That's another one of my numbers. I'm an Evanstonian here for the last 25 years, although I'm told that I'm not, because only people who are born in Evanston are actually Evanstonians. So I have been educated. So I launched work a year ago with most of my research team from WashU in order to really apply the scientific evidence about improving job quality in lower level jobs on the ground, as we're doing with this project. So we started here by looking at, what is the research question that was most important to understand. And as you know, we're looking at how career pathways for entry-level healthcare workers look today. So the main question we're investigating is, to what extent are these folks moving into careers that in healthcare that are offering a wealth building wage? And this was a collaborative process between the members of this group to really understand, like, are we targeting living wages here? Are we targeting family sustaining wages? And really where the group landed was that we want to shoot for the highest level of wealth building wages, where folks can move into jobs that are in the $70,000 to $75,000 range over time, so that they can establish financial stability. And because workers of color are overrepresented among the lower level healthcare workforce, we are really working to close the racial wealth gap as well. So we are currently, we have settled on 2 of the 3 jobs that we will be doing career pathway maps for, certified nursing assistants, medical assistants, and we are in the process of working with partners to identify that 3rd clinical role that we will be looking at. As you all know, these are the 2 biggest, and we're gonna continue on that journey to identify a 3rd. So the project has really 3 parts to it. And in our research, we find that it's extremely important to get multiple perspectives when you're looking at workforce and job quality issues. Because as you can probably imagine, the policies or priorities that are set at the highest levels of organizations, especially in large hospital systems, need to filter down and then play out at the front line. And there's often a bit of a game of telephone and challenges with how we make those things real from our initial intentions. So we're starting with the employer perspective, looking at administrative data about what jobs look like today and the pathways. And then we will be doing interviews with leadership in workforce and human resource area to really understand that high level perspective of where are we today, what are the goals, what are the resources, and what is the intention to move this pathway mapping project forward. From there, that perspective from both administrative data and senior leadership will inform interviews with 30 frontline supervisors who are responsible for folks who are in medical assistant or CNA roles, in order to get their perspective on what is really playing out on the ground with moving folks into these pathways that lead them to wealth building jobs. That whole employer perspective will then inform the next stage of the work, which is to get the employee perspective. You know, we often talk about the importance of raising employee voice in this process. And again, in the many years of research that we have done, it is always very enlightening to speak with employees. And it's really remarkable how many times we're the ones informing them about organizational resources or priorities that they just aren't aware of. Now, turnover, high levels of turnover is a piece of that. It's harder for communication to filter down when people are churning through. But oftentimes there are real opportunities for employers to meet their goals more effectively simply by getting the word out. So in a way, the research is part of the intervention. Employees learn from this process, they can spread the word. So in doing this, we will be conducting a survey of employees across the 5 hospital systems, and all of these analyses will be aggregated and results will be anonymized so that we can really look at the systems as a whole and not employer by employer, so we can get a sense of the ecosystem. And then those findings from employee perspectives and employer perspectives will inform the actual creation of the career pathway maps that April mentioned. So this process is in progress right now. We're collecting administrative data, and then we'll move to interviews. Over the summer, we will be talking with frontline supervisors and then preparing to field a survey for employees across all of these jobs. And we will have results to share and maps to provide at the end of this year. And with that, I will turn it back over to April.
Thank you, Ellen. Before we move on, are there any questions about the mapping project and where we're at right now? Okay. Then before we move on, oh, Kylan, give me 1 second. I'll just do this right now. Before we move on to hearing about the Good Jobs Challenge that I'm sure some of you are really interested in hearing about, I want to direct your attention to this event coming up. Our next industry convening is on best practices in community recruitment, which is something that came up a lot at the end of last year. In our steering committee retreat and in our December quarterly, it was voted to the top as the most desired topic for an industry convening. So we're having this on March 30th from 8:30 to 10 a.m. I really encourage you to help invite more people, particularly your talent acquisition teams. If you could just send them the invite, that would be great. We'll be hearing from one model from Johns Hopkins. I always try my best to bring something in from a different region so we can learn about what other people are doing in different parts of the country. They have a really innovative career coaching model with a very holistic model with many different supports to work with community organizations to get people in the door and to make sure that they succeed in those entry-level roles. So we'll hear from them. Then we'll also hear from Dana Anthony with Rush, who runs an application hub model with Westside United. And we'll also learn about a partnership that I have seen to be one of the most successful in getting a large number of people through the door and succeeding in their roles, which is the partnership between Skills for Chicagoland's Future and University of Chicago Medicine. So please mark your calendars. I will drop the registration for that event in the chat right now. And I will also pass it over to Kylan Fisher with Chicago Community Trust to talk a little bit about the Good Jobs Challenge and how that affects us at CHWC.
Great, thanks, April. Hi, everyone. My name is Kylan Fisher. Like April said, I am, or actually, so within Chicago Community Trust, I am with Chicagoland Workforce Funder Alliance, and I serve as the program director for employer-led workforce solutions. So within that role, one of the big things I do is I am the convener of what we call NEWS, the Network of Employer-Led Workforce Solutions, which is a network of all the different sector partnerships in the region in which CHWC is a member. Also, that role, I did a lot of work on the EDA's Good Job Challenge grant application that was submitted on behalf of the Chicago ecosystem, in which CHWC was a really active part of. So I'm just going to go over today. First, just what is the Good Jobs Challenge grant for those who didn't get to participate as closely on those projects. What specifically is in the Chicago application, how news is going to support this work, and also specifically what is CHWC going to get out of this if we're lucky enough to successfully be one of the award recipients. So first of all, the Economic Development Administration was charged with figuring out a way to help connect employers who need to fill roles and have an understanding of their ecosystems with actual training programs to get better results and to get people back to work in our new normal. So they've developed the Good Jobs Challenge grant. So this is grants that are going to go to entire ecosystems or workforce systems, not just one individual program designer. Applications were due back in February, and the EDA just announced that they received 509 applications from all over the United States. They're going to grant about 25 to 50 awards for anywhere between 5 to 25 million. The Chicago application, we came in at asking right around 22 million. Then if we receive the grant, it's a 3-year grant cycle, which has 3 very distinct phases. The first phase is really focusing on building up sector partnerships and building up tables like this, both to create new ones, but also strengthen existing ones and make sure they have all the things they need to be able to move forward into the next phase. The second is actually employer-led design of programs. So really developing training programs that are what the employers are really needing, particularly coming from things like career pathway mapping and things like that CHWC is already doing. And so really incorporating that knowledge and designing programs that come out of that knowledge. And then finally, phase 3 is the implementation of those programs. Like I said, the application, we submitted it on February 10th. And we hopefully will get awarded $22 million in July. The Chicago specific application has 4 different sector partnerships, 3 that already exist: healthcare, you all, information technology, and manufacturing. All those tables already exist in Chicago, but we're going to do a lot of work to increase their capacity, increase what y'all are able to do in when it just comes to workload. And then additionally, bringing on a whole new sector partnership within transportation, logistics, and distribution. The project is, the big umbrella is led by Chicago Cook Workforce Partnership, or the partnership as you might be more used to hearing them referred to. So there is a system lead who's responsible for all of the administrative of the data and data collection and the who gets what money and all of that kind of things. But then they distribute those resources down to the 4 sector partnerships. We've also built a really good network of support systems and shared resources. So news, which I convene, is going to be pulling in together a lot of training and a lot of shared resources and a lot of shared documents, so that, for example, if April does something really amazing, I can then go share it with the other 3 sector partnerships so they can learn, and vice versa. So there's really a good understanding of everyone growing together on how do we run these sector partnerships, how do we do really good training. And then also just really focusing on strengthening the whole ecosystem, including bringing in extra support through LIST and Women Empowered to bring extra resources to employers within each table. I already kind of said this, news is just going to come in as a shared resource, making sure that everyone's really learning from each other across the sectors and really leveraging that economy of scale. And then finally, what is CHWC going to directly gain from this? First of all, resources that are just going to allow for more to be done. So instead of it just being April, who is a part-time consultant, having funds to be able to have full-time staff devoted specifically to CHWC. Money to design and implement new training programs. So instead of just going through this amazing career pathways mapping program and finding out what the recommendations are, at the end, having resources to be like, great, let's build some programs, and having the resources and the funding to do that. Part of this project is better aligning public health workforce collaborative with CHWC and having the two organizations work more closely together, still being distinct sector partnerships, but where it makes sense to work together and where it makes sense to share some resources directly because of how closely related you all are, having that integration be better. And then also just additional funding for training programs you all launch will have additional funding for wraparound services so that the people who are going through your programs are even more likely to succeed. And that's all I have on the presentation, but I know April built in a little time for questions. So I will stop my share. And if anyone has any deeper questions, I know that was a very quick high-level overview.
This is Rachel from Michael Reese. Thanks for that overview. It's so exciting. This could be really transformative for our region, especially given some of the additional dollars that are coming down from the feds and the state to support workforce. So really exciting to hear this. Can you remind me of the timeline? You might have mentioned it on your earlier slide, but the timeline for when you might hear next. I know you said that they received over 500 applications, but what's the timeline for notification?
They kind of kept throwing out, originally the original dates, also the applications even got submitted later than the original timeline. So the timelines the EDA put out originally, we're kind of assuming are no longer valid because they were saying spring. I'm going to guess probably early summer. Like I said, with the hope of actually award projects starting in June, July. But like I said, the last time I saw a really good printout of here's our timeline, that was before they had moved the deadline from January to February. So I'm assuming those timelines are also scooched back.
Do you think there's also a possibility that we could get awarded like 10 million versus the 22 ask, like a portion of our ask?
It's definitely possible. They've definitely written into their description that they're going to choose how they're going to do things. The criteria and how to decide to grant less than what is asked, or on something like this where we have, for example, like 4 sector partnerships and there really was good justification on why we asked for the larger number. We'll see. The EDA has never done a grant like this and structured around this kind of very systems building mentality versus just what is this training program or what is the actual project. So it'll be interesting to see how the EDA kind of handles this as well.
Thanks for applying on behalf of Chicago with all the partners.
We're very excited to have CHWC. April, I know a lot of you wrote letters of support to help the grant application, and employer letters was actually one of the highest priorities within the scoring metrics. So one, we really, really appreciate all of y'all. I'm also going to shout out April, that April did an amazing job of being really communicative with the grant team. Organizing 4 sector partnerships was difficult, and so it was very necessary for our individual sector leads to be as awesome as April was. Any other questions before I hand it back over to April? Okay, April, it's all yours.
Okay, well, yeah, stay tuned. I do want to make sure that we sort of hit the ground running when we know whether we have funding for that. So I expect to plan some, very specific sort of planning sessions around the Good Jobs Challenge grant. So stay tuned for that.
April, I just remembered something I forgot to say.
Yeah, go for it.
So actually we're continuing, the 4 sector partnerships are actually continuing to meet on like an every 2 weeks basis, because we've all kind of committed that whether we get this grant or not, some really good ideas came out of this, and one way or the other, we will find a way to make some of these things happen. It might take longer, it might take a lot more wrangling of resources. But if you got excited about something you heard about through this, I can't promise it's going to happen, but we are working as an ecosystem to try to make as much of it happen. So April's going to be involved in those conversations as well. So.
And okay, so now I will pass it over to Christopher Redden, who is joining us from Rosalind Franklin University College. Excuse me, to talk about their new nursing programs. And Chris, we are actually a little bit ahead of schedule, so feel free to take closer to 10 minutes than 5.
Okay, all right, let me do doing the screen sharing here. Can you all hear me?
We can hear you, and I did make you a co-host, so you should be able to share your screen.
There we go. Yeah, for some reason it is not. One participant share at a time. This is one.
Click on the green arrow.
Yeah, there we go. All right. Okay. Well, my name is Dr. Chris Redden. I am the program chair of the new Doctor of Nursing Practice Psychiatric Nurse Practitioner program at Rosalind Franklin University in North Chicago. And so just a little bit about our history. So Rosalind, I don't know if any of you are familiar with Rosalind Franklin, our namesake. But Rosalind Franklin was the co-discoverer of DNA, and her picture, which you see on our emblem, is actually what led to the discovery of DNA. And, you know, it's kind of a sad part of the times where she was cut out of the discovery. Watson and Crick won the Nobel Prize, and she kind of continued to work and died very young. But her story, and without her discovery, we would not have discovered DNA. And so really the philosophy of Rosalind Franklin University, which makes it so unique, is we are all about inclusion, diversity, and intraprofessional education. And that has kind of led us to the development of this new College of Nursing. So there are 6 colleges, and the College of Nursing is the newest college. Oldest college is the College of Medicine, which was the original Chicago School of Medicine, goes back to the turn of the century, about 1910. The latest college, the Dr. Scholl School of Podiatry, I always thought that was a made-up person, but the actual Dr. Scholl is a Chicago legend, and the Dr. Scholl School of Podiatry was also located downtown, established around turn of the century, and joined Rosalind Franklin in the early 2000s. So first college in 20 years. And really our mission is to continue the Rosalind Franklin mission, which is—
Sorry to interrupt, Chris, but a few people are saying in the chat that they're hearing some feedback, a squeaking. I don't know if you're able to like talk closer to the mic, or that would help.
Sure. Is this any better? I'm moving the mic a little bit closer to me. Is that any better?
I hear you all right. Other people do not.
Okay.
I don't know what's going on because I am hearing you okay.
Okay. Well, so I'll slow down a little bit and I'll try and enunciate. I won't use my Minnesotan accent.
Thanks.
So the College of Nursing, we basically about 2 years ago started, and again, this is really fortuitous because we are also working on a workforce development and a pathway from high school into junior college, and then graduate school. And so our College of Nursing, we're the first College of Nursing in Lake County. We have one of the most diverse communities in Lake County in the state of Illinois, from lowest income to highest income. And our commitment is to the community. We're for the community, by the community. And that's really kind of our overarching mission. And we are actively engaged in recruiting diverse staff, diverse students, and that's kind of our overarching goal. The need for mental health is just extraordinary. And I'm sure some of you have heard of food deserts. Well, we have mental health deserts in this country. A third of our country is without mental health services. I put a few big numbers out there. I'm a veteran. My colleagues, Dr. Dan Medlock, who's with me, is also a veteran. Lisa Marie Walsh is coming from Emory. It's another one of my faculty members. And we all kind of work in areas where we see patients that come from a long distance to see us. So in the veteran community, just for an example, something like 14 to 17 suicides a day. And of those, only 3 are actually even receiving mental health services. And that is just a reflection of what's going on in our country. You know, we have services in populated areas and we don't in the extended. And just in Lake County, again, huge desert. 122 million Americans living without with a shortage of mental health providers. And we're expected to need over 6,000 new providers to fill those gaps. And we expect my profession, the psych NP, to grow by 31% just in the next couple of years. And so we are out here to meet a need, not only for our nation, but for Lake County. Now, a little bit about our program, and we have 3 programs right now, and I'm going to talk about, I'm going to focus on the DNP, but I'm going to talk about the other ones. So our program, again, Rosalind Franklin University is a graduate school of health science graduate school. So again, medical school, pharmacy school, physical therapy, physician's assistants, all masters and above preparation. Besides our nursing college, we also have the College of Health Professions, and there's psychologists and counseling degrees within that college as well. For our program, again, this is the psychiatric nurse practitioner, doctor of nursing practice. These are already established nurses.
Chris, I'm sorry to interrupt again, but we're still seeing your first slide. And I know your other slides show a little bit more about your different programs. Were you trying to show us that?
No, all you see is the first slide?
Yeah, we're on the first slide. Or we can see
I'm on slide 4. I'm on prerequisites. Let me stop and share.
You have, I think you're sharing the a different window just from PowerPoint, and you've launched a screen a slideshow in a different window.
Okay. Yeah, the beauty of Zoom.
Yes.
Yeah, I'm gonna stop.
And then hit,
Yeah, I mean, that's where we're at. Are you seeing?
So we're okay now that you've clicked on slide 4, we can see it. It's sort of small.
Yeah,
we're seeing the full PowerPoint window, and we're not seeing it as a slideshow.
yeah, it's not, let
That's
me
all right.
restart.
And I will send all these out to everyone afterwards as well.
you can move this top. You can hit presenters mode. The Zoom bar. Yeah, you can move the Zoom bar up top.
What are we talking about?
Can you scoot the Zoom bar to the side? At this bar up here.
This bar.
Yeah. We'll just scoot it over.
Oh,
Grab it and scoot it over.
right.
Yeah, there
Okay.
you go.
All right.
Go back to your PowerPoint, and there should be a presenters mode that you can hit. Go to your new share.
Go down to the thing, I have the PowerPoint presentation.
Yeah, I did. Yeah, it's not showing up. It every time we do this, we learn something. Yeah, I'm sorry. It's just the PowerPoint is not allowing me. I'm going to make it as big as I can.
That's a lot better, Chris. Yeah, that's good.
Okay.
And I'll send everyone the slides afterwards.
Okay.
Yeah.
So,
Thank you.
all right. So you can. That's even different from what I have up on my screen. Okay. So this circle represents kind of the 4 components of this program. Prerequisites. These are already licensed RNs. We have a bachelor or a master of science and some experience in mental health. And that experience can come from hospice nursing. It can come from working in the emergency room. It can come directly from a mental health or psychiatric environment. We have because it's a doctoral program, there are scholarly components. We teach research methods. They do not a traditional dissertation that you would see in a PhD, but a doctoral project that is an evidence-based practice. So doctors of nursing practice translate research into practice. And that's kind of that core doctoral essentials. The science core, because they are nurse practitioners, They learn the same science core as the nurse anesthetist, the family nurse practitioners, the critical care nurse practitioners, because even though I don't manage blood pressure and diabetes, I still identify it. The medications that I prescribe, the therapies I prescribe can impact all disease processes. And sometimes I'm the first person to screen somebody for these diseases and disorders. The clinical simulations, the didactic, the direct care core, we have 1,000 hours of clinical practice. So we teach therapy, we teach psychopharm, we teach, and we do it in a simulated environment before we get into direct clinical care. Now, our clinical partners, right now, we are partnered with Lake County Public Health, Captain James A. Lovell Federal Healthcare. Now, can you see this slide?
Yep, we can see it.
Okay, and Northwestern Medicine, which again is McHenry and Lake County, and along the North Shore, and then the Children's Ann Lurie Children's Hospital in downtown Chicago. Because again, this program is throughout the lifetime. So it's birth to death. We manage mental health, pediatric to geriatric. So a little bit more about our college. We've just launched in January. We have our new facilities. We actually have a brand new facility. The third floor of the building we're currently in is going to be a brand new nursing college. Our nurse anesthesia program is currently housed in the College of Health Professions, and it's been around for about 13 years, very reputable. They get 300 plus applicants for 30 slots each year. Interesting, and again, this is where I think it's very fortuitous that we're talking. We are establishing a Master's of Entry to Nursing practice. So there's multiple entries to take the NCLEX, which is the RN exam. But what this Master's of Entry practice is tied to our pathway, and our pathway is with our Lake County partners, health counties, the Lake County Community College, Lake Forest College, and really this program is designed to mentor young individuals in high school, starting in 9th grade, and when they're 16, they're eligible to take a CNA license, to work in our partner health systems, and paid summer internships, and then mentorship, not only within nursing, but within medicine, within bench science, within all of our programs within our university. And it's really kind of an exciting program. And we've actually funded to kind of launch that. We're hoping to launch that either this coming summer or the following summer. But that work has been going on for a couple of years. And I think would be a really great opportunity to partner with you all. And that's really all I have. I'm glad we had extra time because of the technical issues, but I just wanted to give you guys kind of the rundown of my program, to talk a little bit about the college and the pathway. And I guess we probably do have a few, do we have any time for questions or do you?
Yep, if anyone has a question, we could do questions. I don't know if we do. But I will send out these slides, Chris, with all the meeting materials with your contact information so that anyone can follow up with you about this program.
Great. And we're doing info sessions on the Psych NP program every couple of weeks. And from our website, our College of Nursing website, there's actually links to click on how to apply, the prerequisites for the course. And our marketing department, again, if there's a chance to partner with you for any of these events where you're doing career planning, we'd love to be a part of that.
Well, thank you so much for joining us, Chris, and for presenting this opportunity to all of us. Much appreciated.
All right, thank you.
And with that, I'm going to pass it over to Upwardly Global. and Rebecca Neuwirth and Tamar Frohlichstein to talk about hiring internationally trained medical professionals. There are some exciting things happening with that work that I want you all to see. Chris, would you mind? Yep, there you go. And Rebecca, you should have screen sharing permission.
There. Hi, so nice to meet you. Thank you so much, April. And I will try to share my screen right now. We're really appreciative of this opportunity to present to this group and really grateful that the Chicago Healthcare Workforce Collaborative exists and the work that you're doing together to build the field and the opportunity to speak a little bit with you about what we think is incredible untapped potential that exists in the state and frankly in the country, which we believe together we might be able to tap into to the well-being of the state, those people seeking healthcare in the state, and the individuals who will be sharing a little bit more information about. April has been a wonderful, wonderful partner, and so grateful for her support and thoughtfulness throughout the process that we're going to be sharing a bit. So I will try. Can you guys hear me okay? I'm thinking so. Great. And I will see, how do I share my screen? I am sharing the screen, but for some reason, where's the little button where I share the slides?
Up on top, you should be able, where it says slideshow.
Slideshow, thank you. Thank you, Tamar.
No worries.
That looks great, Rebecca. Yeah, perfect.
Great. We wanted to start by sharing a little bit about Upwardly Global, and I'll do that. I'll also introduce myself and my partner, Tamar, not only in slideshow sharing, but somebody who's dedicated so much of her life and care and passion, knowledge to the work that we'll be talking about today, and who really leads all of our healthcare efforts across the country and happens conveniently to also be based in Chicago and a loyal and passionate Illinois residents. Then we'll talk a little bit about the healthcare challenge that we think is addressed, some about this untapped talent source, and Tamar will share that. And then really 3 areas where we think there's an opportunity for immediate and impactful action if you choose to join with us in any of these areas. And then we hope that we'll have a little bit of time for questions, which is the most important part of all. I wanted to, again, thank April. I think before I go into the presentation, I think that so many times solving problems, the first and most important component is caring, actually. So as we speak about facts and statistics and legislation, for me, something that drives this work is the passion to be able to make immigration and refugee integration in the country a genuine win-win for all of us. And in order to do that, we need to be able to really understand that the people who come to this country bring very diverse and unique talents when they come, and to be able to see people as the individuals that they are, with the backgrounds that they have and the desire to give back and the education that they bring, and think deeply about how we make this country a country that's able to accept those talents, those individuals, and to truly be what I think the promise of the country is, which is one that can be a melting pot in the best sense of the word, or a salad bowl, whatever metaphor you want to use, but that can really understand that we bring different people together, and when we use their talents and take advantage in the best possible way of their desire to serve, we are doing good for everybody. And so I'm bringing a lot of passion to this work. Tamara is as well. And we're excited to speak to you and to see if there's passion in the group to think with us further. Upwardly Global is, let's see, an organization that was founded just about 20 years ago when a woman named Jane Liu, who was in refugee resettlement, visited a poultry plant, which is basically a nice word for a poultry slaughterhouse, and was introduced to two of the best workers. And it was a doctor from Bosnia and an engineer from Iraq. And she thought to herself, wow, that's interesting that we should find people with those qualifications being, the most diligent workers in a poultry factory. And it shows that there's a really massive disconnect in our ability to recognize the unique talents that immigrants and refugees especially bring to the country and tap them into professions that would allow them to contribute the most. Since then, we've helped over 18,000 people. We're very, very proud that when we work with individuals, we're able to support their return to professional work. So I think everybody, by the way, knows this story. I don't think there's a person who hasn't at some point taken a taxi or a Lyft or an Uber or spoken to a gas station attendant and heard that they were actually a doctor from Ghana or an engineer from Bosnia, and understood that we're not doing right by them or by us when we leave them in those types of positions. Yeah, I'm going to switch very quickly to the healthcare challenge and just set this out. I think you're all the experts on this much more than we are. And this data is changing day by day as well. But I think everyone is very cognizant of the fact that there is a short-term massive demand for healthcare workers that has been incredibly exacerbated by the COVID situation. But even before COVID, there was a medium and long-term large challenge in terms of being able to have enough people to fill the expanding and vitally important healthcare roles in the country. And this is just a little bit of background research that we've done. Like I said, these numbers are changing constantly. Oops, no, there. Most recently, and this is research that actually was done by the Immigration Council, and they're about to release it, so I'm not allowed to officially be sharing it quite yet, but hopefully we'll be able to send you the fully finalized release forms. But they did a little research as we were looking into this issue, and found that job listings for healthcare professionals in Illinois increased from 2017 to 21 by over 98%. And in particular, huge need for obstetricians and gynecologists, but also internists increased by almost 150% in this span of time. And I dare say now that we're 3 months into 2022, it might be even more so than it was at the end of 2021. In addition, COVID really highlighted for so many communities, including, I believe, deeply in Illinois, the need to ensure that healthcare support is culturally competent and appropriate. And what happens when it's not? The fact that there are large groups of individuals who end up not feeling confidence in the healthcare system that we've created if they don't see people who look like them and who can speak literally sometimes their languages, helping to serve them. So that's the need that the work that we do fits squarely into. And I think this is a little bit about the work that we as an organization do. It's really threefold. We work with immigrants and refugees, and in this case, Tamara is focused with a team of people entirely on people who come to this country with healthcare backgrounds. We partner with employers, in this case with healthcare providers like many of you, who are looking for qualified staff. And in addition to trying to make matches to actually support real people into meaningful jobs that they can help with, we are trying to think about how we change systems that systematically make it so difficult for internationally trained healthcare professionals to go back into their work. And I should add that I think of this work as being a win-win, a win for the individuals that we're working with. About 75% are living under the poverty line because they're working as gas attendants, which doesn't pay very well, or trying to work and having a hard time finding work. And we'll talk a little bit about the barriers that keep them from finding employment that would suit their skills, and how we're trying to help and support the training and the connections to employers to overcome those barriers. So the work that we're doing is helping folks often to go from poverty to family supporting jobs, from feeling helpless and not seen to feeling like they have an ability to act and to have agency in their lives. And similarly, I think that it's a great gift to the employers that we're working with to find a group of folks who are deeply eager and incredibly qualified to support healthcare in this country. So with that, I'm going to turn it over to my colleague, Tamar.
Thank you. So as Rebecca said, first of all, I'm really glad that we are here. I'm glad to be here. I know some of you have heard, I've been part of this group now for a while, really excited about all the work that you're doing across the city and state to really empower healthcare professionals in all levels. Yeah, so our work is that we work with these folks who come. We know 45% of recently arrived immigrants have at least a bachelor's degree. And we also know that more than 2 million of them have degrees and experience and are either unemployed or underemployed. And that is the place where we meet our folks. We know that they have challenges, that they need help with job search strategies. A lot of the basics of our training look a lot like what you would see in a college career office, although with a very strong cultural bend. You know, what does a resume look like in the US? What is US interviewing like? We all the coaches work directly with folks around the challenges of licensure and understanding the process, and when we can, supporting them to relicense. We have about 15 to 20 folks nationally we're working with right now who are waiting for next week, which is match week for residents. So hopefully we'll have some great news about some of those folks. We know folks face challenges in language, resume gaps, and lack of professional networks. We work to support them in all these areas. And we also work, as Rebecca said, on the employer side to help employers like yourselves understand this population. You know, oftentimes I'm working with internationally trained doctors who are applying for jobs in research or hospital administration, and helping folks on the employer side to see, you know, the challenges of relicensing are really significant at this point in the US, but these folks come with so much skills and experience that we want them to be working in professional areas. And we're doing a lot of work on our side, looking at some of the healthcare career pathways that if folks from our program, you know, I'm working with a young man right now who is living in Rogers Park, who is a doctor from Afghanistan, and he wants to relicense very badly, but he's here with 2 younger brothers and he needs to support them. And so he's looking, interviewing right now to be a medical assistant in one to get his first start and learn about the US healthcare system, support his family, and then eventually relicense. So that's the kind of barriers our folks are facing. So we know that in Illinois, there are approximately 6,000 internationally trained healthcare workers who are underutilized. We know that number is growing every day. As I mentioned, this young man from Afghanistan came a couple weeks ago. So he's adding to that number, and we're there to support people, you know, from everywhere in the world. We know the US healthcare industry right now is very diverse. 44% is foreign born. The research shows that when healthcare professionals have language and cultural competencies that link to their patients, that it improves patient outcomes. And we also know by our research that 90% of our job seekers, really want to be contributing. They've seen this pandemic, but they also come from places where they've addressed Ebola, SARS, swine flu, so they know how to give medical care in emergencies, in crises, and many of them are working in survival jobs and getting bigger gaps on their resumes and really struggling to figure out how to move into this professional space. So we wanted to highlight a few opportunities. One of the most exciting things that's happening right now in Illinois is that based on the governor's proclamation around COVID emergencies, the Illinois Department of Financial and Professional Regulation has recently, really in January, they put out a authorization that would allow internationally trained doctors to serve as doctors working under the supervision of a licensed doctor in Illinois. We know at this point, as yesterday we met with the IDFPR, almost 800 people across Illinois, the country, and even some international folks have applied for this authorization.
Right now, I think I found the single biggest productivity hack of 2020. It's this Chrome extension called Speechify, and it literally does my reading for me.
So let's say you have to read an.
Okay, a little interruption there. So
technical difficulties today.
It doesn't get easier, does it?
Yes. Go ahead, Tamar.
No worries. So for some folks, who are eligible, are immigrants and refugees. They actually, as I said, don't even have to be in Illinois. They have to have had a license as a physician and have passed all 3 steps of the USMLEs. It's a very simple application process. More tthan 175 as of yesterday have gotten this authorization, and we are working very hard, and that's why we're here today, to help these folks get jobs. Right now the emergency order is through the end of May, but depending on what happens with the COVID emergency, it may be extended. And we really want to help these folks be working in the field. We know this is an opportunity to help employers, clinics, and hospitals realize what a great resource these folks are to meet some of the needs that we talked about earlier. I want to introduce you to Sura. Sura has been working with Upwardly Global for a little over a year now. She has become someone I'm very fond of. She was actually born in Iraq, but she was trained in Syria. She has ECFMD certification, and now she has this Illinois authorization, and she wants to work. She's doing a very low skill, remote medical filing job, working on reports, but she is anxious to be in a healthcare setting. She has amazing skills and amazing personality, and she's the kind of person, here in Illinois, ready to work today. So we see this wonderful short-term opportunity, hopefully, as a pathway. I think we've been working with Representative Teresa Ma in the state House of Reps, and with the head of IDFPR, Mario Treto, and they're very committed to looking at some long-term strategies. We also partner very closely with WES, Global Talent Bridge, and the World Education Services, WES. They've done a lot of work in advocacy and looking at some of the opportunities across the US to provide licensing support for IMGs, internationally trained doctors. Some of the strategies are things like this restricted licensure. In Minnesota, there's some state-funded residencies and programs to help support these folks and help them become ready to apply for residency. A whole bunch of different pathways that other states are looking at. We could talk in more detail. We're really excited about opportunities that would lead to some restricted licensure, or in Missouri, there's a assistant physician license to help these people practice sooner and help your hospitals, our clinics get access to these amazing professionals. So as of now, there's House Bill 5465 that's creating a task force to address these challenges, where we will work in the state to look at the various options, look at what other states are doing, and figure out a long-term solution to create a permanent pathway in the state of Illinois. And one example that we're really excited about is a law that just passed in Washington State, where internationally trained medical grads can get 2-year medical licenses to work as doctors. They can renew this license, and it allows them to, after they've passed the USMLEs and proven their knowledge and their English proficiency, that they can practice as doctors. The problem with the residency process, I mean, there aren't enough residencies for everyone. And so oftentimes these folks, because they look so different from US grads, are overlooked, and this will allow them to practice and be part of a healthcare team with a licensed doctor in the state of Washington.
Yeah, thank you, Tamar. I'm just gonna finish up with a third opportunity that we see. Tamar spoke about there's like immediate hiring opportunities. So we would be so thrilled if SORA would get hired. We care about each and every one of these people, and they're actually extraordinary also. So there's 175 people who right now can practice if we can find healthcare employers who are willing to take them on, which is a super exciting immediate opportunity. The legislative opportunity is a longer term one, but that's about how do we switch out, as Tamar was just saying, licensing laws to reduce the barriers and allow people who come in with immense skills, treating Ebola and not being able to touch a COVID patient, stuff like that. How can we shift that dynamic and build opportunity? And I just wanted to share a third one, which is a really exciting program that we started with New York Presbyterian, which is one of the largest hospital systems here in New York City. They employ about 45,000 people in the city and are, perennially short-staffed. And again, the guy who's there, they call it the head of people. His name is Sean Smith. He's a truly extraordinary person, and I'm sure would actually love to speak to this group. He gets it. His mother's from Jamaica, and you kind of need people who get it, which is why we're excited to talk to you. So he gets it, and he saw the types of people that we're working with, and he said, well, New York Presbyterian, we need staff, and we are committing to offer 100 paid internships to folks that Upwardly Global brings to the table. So we screen them. These are actually not just healthcare professionals, I should add. Obviously, healthcare systems also need folks in IT and administration. And so we've put forward candidates. I think they've hired 65, they've brought 65 people into these paid internship programs. And while they're in paid internships, they're, number one, supporting immediate healthcare needs. Number two, they have a wonderful mentorship program that makes all the difference. And surely, but slowly but surely, they're starting to hire many of those people into full-time positions. I can tell you more about this model. We're very excited about it, and we're excited about the possibility of replicating this model. We believe that it hits so many critical areas, employers who want diverse employee bases, since so many of our people are, having many intersectional identities, and bring diversity of language, diversity of background, and also about 75% consider themselves people of color. And also, have incredible backgrounds. Tamar was just speaking about folks who are coming over from Afghanistan right now. While we have not yet opened the doors to folks from Ukraine, we are anticipating that there's going to be a tremendous amount of refugees coming in from Ukraine too. And many of those people also will bring immense skills, including skills in medical fields that we hope we'll be able to utilize. I was going to share this video, but because I'm a little scared of the technology, I'm just going to tell you the story of Jackie, who's someone who's part of the New York Presbyterian program and someone I've come to know also personally. He was a doctor in Haiti. His wife is actually a pediatrician. They have this adorable 3-year-old daughter. They had to come here as asylum seekers because he was politically outspoken and saw refuge in the United States. They live to this day in a homeless shelter while he has been diligently studying to pass with flying colors the US MLE 3-part exams. We were able to get him a position. I mean, it's just incredibly difficult to set foot. When you come to this country, it's very hard to figure out where to go, which is why Upwardly Global was founded. When we met him, we tried to find a position for him, and he ended up getting an internship at New York Presbyterian. And he's an incredible worker, unbelievably talented, was very underutilized in the position, but recognized for the skills that he brought and for the good work that he did even so. And he was very, very proud. In the video, he speaks about how proud he is to be helping in any capacity at New York Presbyterian, which is a wonderful institution. And to be helping to care for people at a time when they need it so desperately. And finally, literally maybe a week and a half ago, Tamara, you can correct me, he got a position at New York Presbyterian as one of the heads of the public health cardiology division, which is something he can do before he relicensed and without the clinical license. He'll be making, I think, $95,000 a year, and they're getting housing for him and his family. So all of us felt incredibly good about that particular story and the dozens and dozens of other stories that are coming out of that particular exciting experiment. So with that, I think we really just wanted to, again, focus on where we see 3 opportunities and how excited we would be to work with Chicago Healthcare Workforce Collaborative on any one of these. Immediate hiring opportunities for folks who just got authorization. Advocacy, if folks want to join with us, the voice of employers is critically important in trying to move more medium and long-term legislative change. And finally, partnerships like the New York Presbyterian one, which allows us to really help support the building of pipelines of qualified immigrant and refugee professionals who can support healthcare needs in Illinois, even as we're working in parallel on those other tracks. I'm going to stop sharing, I think, now. And of course, April has this presentation and more than welcome. The video of Jackie is incredible. He's very poetic, as it turns out, too. And would love to take questions if there's time for that.
We do have time for questions, and I've also dropped a very quick, I think there's 3 main questions in the poll in the chat, and one of them is asking, which of these action items might you be interested in pursuing or learning more about related to hiring the internationally trained healthcare professionals. So please just take a couple minutes to fill that out. I do know that some of you on this call, are maybe not in this isn't your wheelhouse. This isn't the type of thing that you think about in your everyday work, but your colleagues might. So I really encourage you to help share this information. I know we were on a working group call yesterday and mentioned an example from a different state where there just wasn't a lot of alignment with employers. There wasn't a lot of effort put into rolling out new legislation, and therefore it was a lot of work that ended up in people not getting hired. So I want to help prevent that here in Chicago and make sure that employers are at the table as we're talking about these long-term solutions. So with that, does anyone have questions for Upwardly Global right now?
I have a quick question. So do you only typically work with licensed physicians, or do you work with other healthcare professionals such as PhDs, lab clinicians, that type of role?
Great question. So Ashley, so we work with all professionals. I have dietitians and nurses. We don't see as many nurses because I think the pathways to relicensing are more straightforward. Medical techs, so public health professionals. So we work with everyone in our healthcare pool. The majority of people are doctors, but we have a very big range. And one of the areas that we're spending a lot of energy also, if you have research entities in your hospitals, we provide some skilling support for our healthcare professionals who are interested in clinical research, because we know there's tremendous demand for jobs in that area and a very professional level that really can be a good pathway. So yes, we work with all sorts of professionals.
And just to add also, we also work with IT professionals and folks who have professional experience in administration and more. So finance, accounting. I mean, we actually do work across the board with immigrant or refugee professionals. Tamara is the expert in healthcare, and we think that's a really interesting opportunity right now, and especially challenging. And we have kind of a window at this moment. But as we work with New York Presbyterian, we work across the range of professions that they need to support healthcare, which is broader than just doctors for sure. But we have a lot of them too.
Thank you for that.
Any other questions for Upwardly Global? And fortunately, I noticed during your presentation that I got a couple of emails about people not being able to get into the meeting. I must have had a broken link somewhere. So I am excited to send out this recording and slides to the whole group to follow up. Please, anyone who hasn't done it already, take that poll. And we have a few minutes left if there are any community announcements. If anybody wants to share anything that they're working on or wants the group to know about. Okay, well, with that, we'll give everyone their 5 minutes back. Thank you all very much for joining. I really appreciate it. Have a great day, have a great Tuesday, great rest of your week, and I will send out these materials very shortly. Thanks, everyone.
Thank you.
Thank you, everybody. Have a great day.
Bye.